Hi, in this video session, I would like to describe how the timeline of a breast cancer patient treatment is going to be. Any patient who comes to a breast cancer clinic or any kind of a surgical clinic with a breast problem, he will be undergoing the treatment in the following manner. First, there will be a clinical examination, followed by investigation and staging of the lump, followed by treatment and then the follow-up. Any patient who comes to a breast or surgical clinic will be examined by the clinician to look for any signs like discharge from the nipple or any skin changes. The clinician might also examine the breast to palpate any lumps in the breast. He will also examine the axilla, that is the armpit, to look for any swellings present in the armpit. Based on the findings, the clinician will come to a conclusion whether the patient is having any non-cancerous pathology or a cancerous pathology. After this conclusion, he might ask you for any investigations so that he can confirm the diagnosis. So that's the clinical examination part. After that, he will be directing you to the investigation part. So coming to the investigations and staging, there is a component called as triple breast assessment in any kind of breast problems. One includes the clinical breast examination, next is imaging, and the third one is pathological examination either by an FNAC or by doing a true cut biopsy. So as soon as your clinician directs you for investigations and staging, the first thing you might be advised is to get a imaging. Imaging might be done in the form of an ultrasound or a mammogram of both the breast. Based on the findings the radiologist sees, he might classify you into one of the scoring called as Birard scoring. The Birard scoring ranges from 0 to 6, which can tell us whether it is a non-cancerous lump or a cancerous lump. The more the number, then the more chances it being a cancerous lump. So based on this, the radiologist will telling the characteristics of the lump, whether it is a benign one or a cancerous one. After that, you will be directed to the pathologist who can do a FNAC or a core needle biopsy, that is taking a tissue sample from the lump whichever is present, and this will be examined under the microscope and he gives a conclusive diagnosis whether it is cancer or non-cancerous. If it is a cancerous lesion, on the true cut biopsy, then he might do a further testing called as IHC testing, which can give the characterization of the cancerous lump, that is based on the 4 markers called as ER, PR, HER2 and Ki67. This is called as immunohistochemistry. That tells mainly about the biology of the tumor. So now that triple breast assessment is done, we will be knowing what is the nature of the lump. If it is a non-cancerous lump, it will be dealt in the way it has to be. But if it is a cancerous lump, you will be further investigated to know the staging of the disease. That is mainly to see whether the cancer has spread to anywhere else in the body or not. For that, staging investigations will be asked for. Staging investigations generally include ultrasound of the abdomen or a chest x-ray in case of early breast diseases. If it is advanced breast cancer, they might also ask you for a bone scan or to get a PET CT scan where entire body will be imaged from head to toe. So after this staging workup, the confirmation of your cancer will be done and then its staging will be done, and your clinician will tell which cancer stage you belong to. We will be giving you a staging based on clinical as well as radiological findings. And why do we generally stage is because by doing a staging, we can prescribe you the best available treatment for your stage, and also it helps us in knowing your prognosis. So coming to the treatment part. Treatment, most of the cancers will be mainly dealt by 3 modalities of treatment, that is either the surgery or by a chemotherapy or by radiation therapy. Sometimes all these 3 modalities can be combined and can be used to treat cancer. That is called as multimodality approach. Most of the cancers have these 3 treatments only, but breast, it's one of the widely researched cancer, and it also has additional modalities in the form of targeted therapy and hormonal therapy also. Whether you are eligible for all therapies or not will be decided by your clinician. If the disease is in a very early stage and if the tumor biology is very good, then you might need only 3 modalities or 4 modalities. Whereas if the disease is aggressive and if it is of a bad biology, that means if HER2 and all is positive, then you might need more modalities, like maybe you might receive all the 5 modalities of the treatment. This will be determined by your clinician. As the treatment aspect is very vast, I can't include that in this video session and will be included in individual video sessions later. So your clinician will be directing you to the treatment. In some cases, the surgery might be the initial part followed by chemotherapy and radiation therapy. Whereas generally in case of advanced cancers, we would like to reduce the tumor size. For that, we might use chemotherapy first and downsize your tumor. Like by using chemotherapy, we would basically want to shrink your tumor size. Once the tumor has shrunken in size, then we can consider for surgery. So this decision also will be made by your clinician. Once your treatment is completely finished, then your follow-up period starts. Follow-up will be from the time of finishing your treatment to 5 years of duration. Initially, in the first 2 years, we will be asking you follow-up every 3 monthly so that we have a close watch on your clinical status. After that, for the next 3 years, we might ask for a 6 monthly or a yearly follow-up. During this follow-ups, we might ask you for investigations along with the clinical examination. Generally, the doctor will be examining your breast to look for any recurrence, and he might also ask you investigations in the form of ultrasound and X-ray and the mammogram of the remaining breast, so that if there are any local recurrence or presence of malignancy in the opposite breast can be looked for. So this is how it generally works. So coming to the timeline, clinical examination, investigations and staging should take maximum 1 to 2 days, followed by your treatment aspect. Surgery will be done in a day and the drain removal and other process might take a week's time. But for any other treatment to be applicable, there needs to be a gap of 3 weeks after the surgery. After surgery, you can either undergo a radiation therapy or a chemotherapy as chosen by your doctor. Radiation therapy will be generally for a duration of 21 days to 30 days, whereas chemotherapy will depend based on the number of cycles and whether you are going to receive a targeted therapy or not. Each cycle will be for a duration of 21 days. That means you receive a chemotherapy today, then 21 days of gap will be given, followed by second cycle, and then again 21 days of gap will be given, followed by third cycle. Like that, it depends on how many cycles you are going to take, and based on that your chemotherapy might vary from a duration of 3 months to 6 months. If you are going to take up targeted therapy will be generally given for a duration of 1 year, followed by hormonal therapy will be applicable as per your IHC status. Hormonal therapies are generally given for a duration of 5 to 10 years of duration. Follow-up period starts from finishing treatment to 5 years of duration. Follow-up treatment is independent of your hormonal therapy. During your follow-up period also, you will be taking your hormonal therapy.
Thank you.